Okay, this is from the book Dr. John McDougall, The Doctor Who Fought for You by me, Pete Rogers. We're in the chapter on hypertension. This is part 2. Okay, so sodium, salt plays a role in high blood pressure, but it's nowhere near as important as dietary fat. Dr. McDougall, and especially him and Pritikin, emphasize the role of dietary fat in hypertension. And it is more important than sodium, but sodium's relevant. When you lower sodium intake to about 2,300 milligrams per day, you only get a small reduction in blood pressure, about 3 millimeters systolic over 1 millimeter diastolic. But you can get a really big lowering of blood pressure if you lower that sodium much farther to less than 500 milligrams per day, like what Kempner did. Then you can get a profound drop in your blood pressure. The McDougall diet typically has about 500 milligrams of sodium per day. He would suggest to patients to put a little bit on the outer surface of their food if they wanted to, but not to put it into the mix when they're cooking, so to speak, because that way the part on the top, you get more taste from it, but you don't get such a high sodium dose. Hypertension should only be treated with medications after it has been sustained for months at 160 over 100 or higher. So that's an important statement. So McDougall does not rush in to treat hypertension, and he doesn't treat it based on just one measurement in his office. No. Sustained high blood pressure, preferably measured at home. The best medication for hypertension is the diuretic chlorothalidone. These are the words of Dr. McDougall in his newsletters and videos. The best medicine for hypertension is the diuretic chlorothalidone, and blood pressure should be lowered to no less than 140 over 90. So what he's saying too is you don't want to go below 140 over 90, because I know a lot of patients, doctors, that are always telling me, they want to keep getting their pressure lower, and I'm like, I don't think that's a good idea. You might have a stroke if you do that, or pass out. Imagine you're driving and you drop the blood pressure to your brain. You could pass out, crash. McDougall says, usually I can successfully treat hypertension by diet alone. When I need to use medicine, I use chlorothalidone, CTD, because it has been shown to reduce the risk of stroke. Chlorothalidone is a diuretic, but it is not the same as hydrochlorothaloside, HCTZ. Hydrochlorothaloside is the most commonly prescribed diuretic in the United States by far. Chlorothalidone is the only antihypertensive medicine that has been shown to reduce the risk of stroke. There's a very narrow range of blood pressure for which you should treat hypertension. If you look up the papers, you will see there is a very good reason to choose chlorothalidone as the best medicine for treatment of hypertension. And here's one of the references: treatment of blood pressure targets for hypertension, review of the Cochrane database, and it basically said treating patients to lower than the standard blood pressure targets of 140 over 90 does not reduce morbidity and mortality. So there's nothing to be gained by over-treating it. You run increased risk of stroke in the patient. Another reference here says that all people with high blood pressure, borderline or high normal blood pressure should be advised on lifestyle modifications. Try all that stuff first. Only go to pills if you need to. Initiate hypertension if sustained greater than 160 or systolic and greater than 100 diastolic. So that's good to know, because again, a lot of people are over-treating their hypertension. Okay, let me scoot this over a little bit here. More references, and again, this also, I put a lot of references in here, so if you ever have to argue with other people about it, you can find the references very quickly. Let's see, what else does he say? So this is just more references that say the same thing. And here he is, several ones saying, don't overtreat your blood pressure because it could kill you. It'll give you a stroke if you drop the pressure to your brain too low. Okay, so that's it for part 2 on hypertension.